What new and promising treatments are emerging for advanced liver cancer, and how can patients learn whether these are options for them?
So the management of advanced stage liver cancer has changed dramatically in the last 10 years, and particularly in the last 5 years. And what has changed in the last 5 years has been the introduction of immune-based therapies. So immune-based therapies now are the backbone of the treatment of patients with liver cancer. There are different regimes, there are different combinations, and they're very effective in a subset of patients. Between 15 to 30% of the patients will have a response, what's called an objective response, when they're treated with immune-based therapies. And some patients, the response is dramatic, it's spectacular, it's a response that we haven't seen ever. So it is true that some patients, and unfortunately, we don't know who they are. So we don't know upfront who's gonna benefit significantly from this immune-based therapy. So that has changed, and certainly now that we see this remarkable tumor response, we're starting to consider, more radical treatments for these patients. So let me give you an example. 10 years ago, if you have an advanced HCC, you would receive treatment with systemic therapies, mostly sorafenib, and you will have an increase, or you have prolonged survival. Now, with the new treatments, we can see significant regression of the tumor to a point where, surgery or even transplant can be considered again. And that's something that is new. Obviously, it's not an option for everybody, but it's an option for some patients, can be life-changing. So I think that connects to what we talk about, to being, evaluated in a transplant center, because now that we can apply systemic therapies more widely than immune-based therapies, provide these significant tumor responses of the patients when we start to reconsider more aggressive treatments in these patients.
Okay, thank you. And do you have an activation tip for that question?
I think that my activation tip would be that there are many treatment options for advanced HCC. Most of them are immune-based, and they have changed the natural history of the disease to a point where we can even consider surgery or transplant in patients that achieve significant response with these systemic therapies.
Dr. Villanueva, for patients hearing about immunotherapy or targeted therapies for the first time, what should they know about the benefits, side effects, and how these treatments may impact daily life? And I actually might back up first and ask you to give a brief definition of what is immunotherapy, and then talk about the side effects and benefits, please.
So immunotherapy has, transformed the management of cancer in general. Actually, the people that discover and develop these therapies were awarded the Nobel Prize a number of years ago. So essentially what these treatments do is they activate, or they reinvigorate the immune system to be able to recognize the tumor cells and eliminate the tumor cells. The good thing in liver cancer is that because of the cirrhosis that most patients have, traditional chemotherapy was either not effective or too toxic for patients with liver cancer. So conventional chemotherapy was not being used, was not being applied in liver cancer. Now with immunotherapy, it's different, because the side effects, the safety profile is much more favorable in patients with cirrhosis. So we're able to treat these patients with immune-based therapies. So the treatments are generally well tolerated. The main side effects are related mostly to the hyperactivation of the immune system, to a point that it starts attacking other organs that we don't want the immune system to attack. So the lungs, the kidneys, sometimes the liver. So these are the main side effects. It's like this overstimulation of the immune system. But compared to the side effects of conventional or traditional chemotherapy, they're significantly lower in patients with cirrhosis. In terms of the targeted therapies, it was the first type of systemic therapies developed for liver cancer. These are what's called small molecules. These are pills that are specifically targeted to antagonize the effect of a specific mutation or a signaling pathway that is activated in the cancer cells. So they're less specific and has a different type of side effects. So liver cancer, the ones that are recommended, generally they can increase the blood pressure or cause some, losing some protein in the urine, or they can cause some skin reactions. So those are the main side effects of targeted therapies in liver cancer.
And you mentioned that these are fairly well tolerated, typically, especially compared to traditional chemotherapy. But as a cancer patient myself, when I hear my doctor say that, I sometimes want to know, well, what does that mean? Does it mean that if I work full time, I might have to drop down to half time? And I understand that every patient's going to respond differently. But what do you tell your patients? How will that impact their life in general or their daily living with these immunotherapies and targeted therapies?
So again, it depends on the patient, but most of them, the impact doesn't significantly change their routine life, So unless they develop specific, pneumonitis, which is an inflammation of the lungs, or, nephritis, which is an inflammation of the kidneys with, functional impairment, or, fever, or this type of immune-related side effects, most of them can continue with their lives normally. So that's the beauty about these treatments in liver cancer, at least.